physical therapist assistant today. Can I verify your name and date of birth, please?
Yes, you may. My name is Nikki Robertson. My birthday is 2/19, no matter the year. That's my RN.
Good. I like the no matter the year. I'm
Yes.
going to start saying that
Yes.
myself. So,
1995.
so your point of care calls for some measurements of goniometry to look at your knee range of motion. They also want us to check your hip range of motion because you got two joint muscles that cross both joints. So we want to make sure you're not limited in either joint.
Okay.
Are you okay with us doing that
Yes.
today? Okay, so first we're going to have you lay on your back here. And we don't use a pillow because we don't want to have any false readings with our goniometer.
Okay.
Okay, and is this
It's not like me. You want me to lay the other way?
yes, that way we'll see you better. I'm sorry, I should have
Okay.
said that. Okay, so they did all of your sensation checks and everything at the last visit, and it looks like you have healed well. Can you tell us when you had your surgery done?
April of 2022.
Okay, and tell us a little bit about that injury.
So I was snow skiing on a blue, and there was somebody standing in the slope, just standing there. They weren't doing anything, and I crashed into them.
So I did something very similar. My first time to ski, I was skiing on I think a green, the bunny slopes, and I got knocked into a black and was coming down the black.
I'm glad you're still here with us.
Yeah, I had a little bit of a head injury.
Yes, that's why you should always wear helmets when you ski, guys.
Okay, so what we do is we put this towel here under your knee
Okay.
to see if we can get it to kind of relax into full extension here. Is that hurting you to do that? Okay, just let it go and go ahead and lay back so you can just relax. All right, so you've had trouble with getting the full extension. You've had the extensor lag. Is that what I'm understanding?
Yes, does that mean bending all the way?
Plus getting it all straight and bending it all the way to the 135.
So I can extend it all the way, but I cannot bend it.
Okay, so you shouldn't have an extensor lag, but the bending is a problem. Okay, so we're going to line up our goniometer, which is just an angular ruler, and we're going to make sure that our axis is right here at the lateral epicondyle of the femur on your left. We want to put our stationary arm in reference to your greater trochanter, and we want to make sure that our moving arm is in line with your fibular head and your lateral malleolus. Okay, so we're going to do active first. So I want you, don't move your pelvis. In fact, Allie, will you hold her pelvis right here for me? Just keep her from tilting in either direction. And I want you, as you bend your knee, you can bend your hip towards you. Okay? And you can do that now. There you go. There you go. Okay. So is that about?
That's as far as it'll go.
Okay, that's not bad. So we are at 0 to 125 degrees. So would you then go passively? Why? That's right. Okay, so we're going to do passively. Okay, and I already see that you have full extension there even without the towel. So I want you to relax. I'm going to reline things up with my landmarks, and I'm going to do it. So you just relax and let me go through the range, and I'm going to push you until I get to the infield. And that's it. Did it hurt? So I got 130 degrees, 0 to 130 degrees, passive range of motion of the left knee with a very firm infield, okay? And it's almost a normal infield, but I would almost give it a little springy to it to tell me that we're not quite to where it needs to be, okay? So I wouldn't say that's a normal infield because she can still get a little more range. Now, do you have hardware in here still?
There's no hardware.
Okay. All right, so we know there's no hardware in here that should block her. She's only lacking 5 degrees though. Where did you end up in therapy lacking?
I can't remember what I ended at because I could only get to 75, and then he had to take me back in and crank it down under anesthesia.
Wow.
So he had to bend it. And then after that, I could get to like I think I stopped therapy at 130 or so.
Okay, so you're maintaining good range of motion then, but you need to keep it up. So, because you don't want to lose any. Because what we're going to learn later in the semester is you need at least 110 to 115 degrees for normal gait. Once you have less than that, then you're going to have gait deviations, which she probably had before she had her full range of motion. Now, why would we do her hip range also?
Insufficiency.
That's correct. So if she's got some limitations into knee flexion, what could that limit? Why?
Because rectus femoris inserts low.
Tightness, okay? So we're gonna do her hips, okay? Allie, I'm gonna get you to help me again with her pelvis so she doesn't have any pelvic cheating. You didn't know that was a thing, did you?
I did know that.
Okay, so I'm going to come here again and I'm gonna line up this time at the greater trochanter because we're looking at hip range of motion. We're looking at here, this lateral midline of her trunk going along with the pelvic iliac crest. And then our moving arm is gonna be aligned with the lateral epicondyle, okay? So what I want you to do is flex your hip, but let your knee relax into flexion as you flex your hip up.
Like
So let this relax.
Okay.
And then go up.
Okay.
Yeah, let the knee come down. There you go. And go as far as you can. All
With my
right.
hip.
With the hip.
Okay.
Okay, yeah, don't let her cheat there.
Oh, sorry.
Okay, so what should our norm be on that, class? Okay, so I am getting 0 to 105. So would I push her a little bit further? Okay. All right. So I'm going to leave her up here for time's sake, but I would take her back down and do it again. And this time I'm going to push her. And there we go. All right, so I got the 120 degrees. And with her, I did not get a soft infill. So sometimes you get what on hip flexion? Firm infill. So she has a firm infill, which tells me that a little bit of muscle tightness is stopping her movement and not the muscle approximation. Need to be somewhere?
No.
Oh, okay. All right. So now, what would I measure?
Hip abduction.
That's right. So I'll move this hip out of the way, okay? And I'm going to line up on what?
The anterior superior leg spine.
That's right. So I got my ASIS here, I'm going across here, and then I'm lining up with the anterior aspect of my patella, okay? So I'm gonna start you here at neutral, and I want you, Allie, will you make sure with her hip, to slide it out as far as you can.
This way? Or an abduction? Okay.
No, hold her hip here.
Okay.
Let me just, she's an overachiever.
Hey,
so-
Allie. Hi.
Okay.
Ready?
Slide it over, yeah. Okay, right there is where your hip is starting to come up. All right, so I am actually getting 0 to 50. And so do I need to do passive?
You do not.
No, I do not, because she has more than the norm on that.
Right.
Very good. Okay, so in order to do a deduction, then I want to make sure this is completely out of the way. I'm going to line up the same way, and this time I want you to bring it in. Allie, thanks. Okay, go in as far as you can. Right there, I feel her hip move. I'm getting 20, 0 to 20 degrees.
That's perfect.
Okay, so do we need to do passive? No. So she has hip abduction and adduction at normal range of motion. Okay, so let's have you turn over on your stomach. Can you flip the other way? I'm sorry, so I can see you. Okay, so what muscle tightness can limit her in extension? Okay, and what else? Quads and what are your hip flexors? Very good. I'm proud of y'all. Okay, so what am I looking at again? Greater trochanter, lateral epicondyle, lateral midline here. Okay, and Allie, just right here, just make sure we don't have any tilting. Okay, now I want you to keep your knee straight this time.
Okay.
And extend your hip. So pick your hip up with your knee straight. So I am getting 0 to 30 degrees. Is that normal?
Yes.
Okay, all right. So I wouldn't need to do it, but she did struggle a little bit. Did you see that little bit of struggle? So if I want it, I could check to see what is my infill here. Is it a normal infill? Even though I've got normal range because of that knee injury, then I could have her relax, and then I could pick it up. It's dead weight.
No, that's
Oh,
hard.
do you want me to help you?
No.
Okay.
You want me to?
Yeah, okay, so I'm feeling a little bit of tightness in those hip flexors.
Okay.
So we need to do some stretching there. Even though she's got normal range, over time, what's gonna happen? It's gonna start to limit her range of motion, okay? So let's check her. Let's sit up here on the side. All right. So I am gonna look at internal, external rotation. I'm gonna put this leg out of the way here. Put this one here. I'm gonna need a towel, Allie, please. And put it right here because what am I trying to gain? Want to make sure that my axis, even though it's at my anterior knee, what is it going to?
The floor.
The hip.
The hip.
Oh, you talking about that? Oh.
The hip joint. Okay. The stationary arm, Josh, is what?
Yeah, that one.
Perpendicular to the what? Okay. My moving arm is going to be in between my malleoli at the tibial crest. Okay. So what I'm going to have you do, you're going to have to get behind her and hold the hips.
You want both of them held?
Yes. Yeah. Okay. So you're going to turn your foot in and externally rotate your hip. So go like
Turn my-
that.
turn my
Yes.
foot.
Yeah.
And then do my hip like
No,
this.
no, no.
Oh.
Keep it still.
Okay.
But as your foot's going in, your hip's rotating. So right there.
Okay.
Okay. So I have, make sure I'm perpendicular to the floor. I have 43 degrees.
Yeah, it's about two.
Do I need to do passive?
Yeah.
Okay. All right. So I'll start over and I want you to relax. Okay. And I will take this with it. Okay. And I may have to make sure I stabilize right there too. And I got it. Okay. So 0 to 45 with a firm infill. All right. And she probably could have hit that other two, but I didn't encourage her because I wanted to show you passive. Okay. So do internal rotation the same way. Line it up through the knee into the hip joint, perpendicular to the floor. Moving arm is between the malleoli. And then this time we're going to have you come like that. Okay. So ready, go. There you go. Okay. So I am getting 0 to 35 degrees. Okay. So I would need to take her. Ooh, nope.
That's you see that face? That was empty.
Did that hurt?
It didn't hurt. It just won't go.
But there was no pain.
Mm-mm.
If it had been pain, what kind of infill?
Empty.
Okay. It was, I met with a lot of resistance, okay? So it wasn't a normal infill. I felt like it was a springy block. It was blocked, okay? So with that being abnormal in her internal range of motion, what would be tight?
IT.
IT band, that's
Oh, you want to
right.
do the IT?
So what do we do now?
The IT.
Oh, the freaking.
never
Oh my
mind.
gosh.
I'm
what's
joking.
that?
So she needs an Ober test.
Yes, that's what it was.
What is that?
Okay, so lay on
It's
the
easy-
side.
it's
with your
easy,
head
don't
right
worry.
here.
On my side?
Yes, that side. Because this one's tight.
A little bit of tension.
Okay. All right, Josh, you want to do it? You sounded like you did. Who wants to try it?
I mean, I can do it. I can do it.
All right. So you're gonna take her. I just need you to relax and let it fall in my arm, okay? So you're gonna take her and you're gonna bring it back
Oh,
and you're gonna drop it.
Whoa. Okay.
Positive.
Allie, where you at, girl?
yeah, oh, I see that.
She doesn't help you. Now,
I'm sorry, I can't help with that one.
let's compare it to her other side.
Yes, it
Okay,
bounced up.
I would, let's do the other side. So flip over with your head here and let's watch what happens there. She's like, Allie, where are you at?
Hey, I mean,
Okay,
it's coming.
so let it fall into my hand. Okay, we're gonna come here and drop. Look
Oh,
at the
yeah.
difference in
You
that.
were expecting
That's
that.
crazy.
But no, but still, this this IT band is loose as a goose. This
That
one
other one's
is.
She's
tight.
not.
Always tight.
Now, why would the IT band be tight when it's her knee that was injured? Where does the IT band insert?
Oh, yeah.
And where's Gertie?
On the tibia.
What does that mean?
It's that
By the
same
knee.
joint.
It crosses the knee. So
Yeah.
all our problems at the knee are now affecting that hip muscle.
That's crazy.
Yep. Y'all saw it though.
Yeah, I think when you.
See, it was hard to know yours because we thought you were just doing it. Whenever you
Yeah, we
showed
thought
us
you were
yours, we
faking
thought
it.
you were just faking it.
No, I have a positive one too.
You do? On what side?
This one? Left?
Left.
Okay.
That's crazy.
So you think we should do a Thomas on her?
Yes.
We should.
Do it.
You see, you done volunteered
Yeah.
for the roll.
Yeah, do them all over. So we can see it again.
You volunteered for the roll.
I was driving to here too.
And I want you to lay back. So we're going to flex your knees up and you grab them.
We need to call.
Okay, and I want you to keep this one while you let this one go. Just let it go.
Wait, keep which one? Sorry.
Keep this one there and then let this one go and drop. I mean, it's not going.
That was it? Wow.
Do this one.
Oh, wow.
Wow. So she got.
So she's got, now let's see if it's rectus or iliopsoas.
Wait,
So
do
let's,
that. Wait, can she
Do that one first.
Can we see it again?
now let this one go.
Look at it. Look how she. Yeah, it's tight. It's tight.
Okay, now let's have her scoot down all the way, and then let's do it. Okay, so back up, and then let's, no, you lay down. Now, just bring this up and let it go, and let's see what it does here. Okay, so it's not rectus, it's what?
Ilio.
It's iliopsoas, which is why what was tight?
The IT.
The hip flexor.
We've got tight iliopsoas, tight IT band, which is what was restriction her range of motion. Okay? Do we think she has a leg length discrepancy? Let's see.
Let's find out.
Oh, I told you, messed up.
Stomach? No, back. Okay, so we're gonna do an apparent leg length discrepancy. Okay, so we're gonna bend her knees up all the way. Okay, just relax. And I'm gonna bring them out together.
Maybe a little.
Like, I mean, like a centimeter.
Very small. Okay, how do we tell if it's femur length or tibia length?
Oh, yeah.
Based on the
knee is
knees.
higher as
Hook
tibia.
one.
Let's look. Bend these knees
Knee
up.
is higher as tibia.
Oh, it is.
It's
Wait.
tibia.
Yeah.
It's tibia.
This is tibia.
Tibia is
About
higher.
a centimeter. Is that true?
I mean, I assumed.
Oh, you thought you had a little bit of a
Here,
leg
can I
length
look?
discrepancy?
Yeah.
Okay, so how would we make sure that we're correct on that?
Get the measurement tape.
Here you go.
Very good. So just relax. So then we will take and tell me what my landmarks are.
The ASIS.
This one
And you
doesn't.
go to the medial.
I didn't know.
I need another one. This one doesn't open.
Oh,
We told you
it's.
But I can't measure it without them. I mean, just,
you're not able to do it by
Oh, that's
this
pretty
site.
cool. I lied.
yeah, but
It's your full measure.
I thought I had mine.
there's in that drawer, Simba, please. Sorry. In the on the right, the plastic drawers, measurement tools. The right plastic drawers. The second from the bottom, or third from the bottom.
Oh, I did this test on my mom. There's so many. She has hip problems.
And she had a leg length. Got it? Yeah. Here we go.
You catch?
Yes, that doesn't work either.
I don't think this will work.
That was an epic fail, y'all. Did you get it on video? Please put that on the graduation show. I'm walking this one.
Put it in her hand. Put it in her hand.
Two hands. Two hands. Get some.
Okay, what am I measuring from? ASIS to.
Medial malleus.
That's correct. Okay, so I'm doing it in centimeters. So I'm coming here, and I am at 91 exactly. Okay, did we say this one was longer?
Yes.
Yeah.
Okay, so let's look at this. And I,
it was small.
91 and a half.
Yeah, it's like a half.
So we thought there was a centimeter that was apparent, an actual half centimeter, so very close.
Yeah.
So see how close you are when you don't have a measuring tool, you can get an idea.
Why do you measure from the opposite ASIS? Why do you measure it across?
Did I?
Not- Yes.
Because
I just thought it was like a,
did I measure this across too?
you measure.
Both sides.
Both of them.
Okay, well, this
I don't
one
do it right
is
tomorrow, I know
87. Stop it. All right, 87, 86.5. Still right.
Yeah.
Thank you, Jay.
We're right.
Measure from ASIS to medium amount. I told you
Of
my
the same
brain
side.
and I don't sync my
I
motor
never
skills.
used this.
They're used to me. Okay, so we have done a Thomas test, an over test, a leg length discrepancy. The only thing we didn't do was a congenital hip dislocation. And would we do that on her? She's not a baby.
Not a baby.
But what is it called if she were to have a hip dislocation? What's that clip called?
Oh, Ortolani.
Ortolani. And what type of position would they need to be splinted in?
Oh,
Abduction and very good. And what are you trying to develop into acid habular pregnancy?
All right, that's why it clicks because it's popping out.
Okay. Of course it is. Okay. Anything else you want from our client today? She was a very, very good client. Okay, that means when she needs volunteers for ultrasound,
I'm in that.